All right, so today is day 21. I have 9 more shifts left, and yes, I am down to counting down. Tired of this place. So I walk in today to the ER. I'm not in ICU, which I guess is better. Wow, look at my face. And I use the Cavion wipes, so thank you very much, Amanda. And I use that gel in the inside of my nose, the ointment that you gave me. Thank you very, very much. Anyways, so I walk into the ER. I hadn't been there for 2 days. And lo and behold, there's more travelers. Kind of crazy. I think 4 nurses did not have patients all day today because it wasn't that busy. I mean, for the main COVID area. It was a little bit busy for the non-COVID area, which is funny to me to say that because I feel like they're all positive, but whatever. Anyways, and so they stuck me in triage, which normally, if you all know me who work with me in the ER, I'm pretty fast at my triages. So, didn't think anything about it. However, their charting system is shitty. So it's not something that goes fast, and nobody actually went through their charting with me. So I had to figure that shit out on my own, which that's fine, whatever. But then I'm severely micromanaged too, which if you all know me, does not go well with me. So to move a patient out of triage is very difficult. Not only do you have to talk to a doctor, but you also have to talk to a nurse to get them out of your triage. And then somebody else micromanages that portion of it, because then I was talking to the wrong ER physician and the wrong ER nurses. So I got micromanaged there too, to tell me which ones to actually give it to. Even though we had many nurses that didn't have any patients, but whatever. Fucking shitty. Absolutely shitty. So there's 3 nurses out there in triage. 2 of them are staff and me, who's traveler. I pretty much do all the triages because they're just sitting on their asses micromanaging me and telling me every step of the way about how I've done it wrong. They don't have protocols. So anybody that comes in, we don't do shit with. None. I get an EKG and that's it. Yeah. So I had a patient, 31 years old, who came in with chest pain and shortness of breath. But because he had shortness of breath, they put him in COVID. Not been exposed to COVID prior to that. He's probably now got it because he went into the back, which is the positive side, and the negative side. He went into the positive side because he had shortness of breath. No fever. No sick contact. Well, now he's got COVID. Because it's just blowing in the air. I'm really annoyed. And so I actually talked to one of the physicians that he moonlights there, meaning he just kind of works there per diem. And he asked me how it was in triage. I think he wanted to hear my honest response, because by that point I was giving my honest response, and I told him, and he goes, yes. He goes, what you're finding is actually the oxymoron of New York. He goes, yes, New York, you would think, has some great things because they're so innovative with other things. Not at this hospital. Some hospitals, he said, have exactly what we have, and that's all protocols. And I can get through it really quickly. Not here. Not here. They don't let nurses do shit. The OGs that I've been putting in, it's supposed to be done by a doctor. I'm pretty sure that's nursing 101. The ABGs that I've done, because I did ICU, know how to do those, no problem. One's supposed to do those. That's all doctors too. Can't put an IV in until I get a doctor to see the patient. And even then, have to wait. Yeah. So triage was painful. But they ask everybody about HIV and Hep C. And if they haven't had a test in 6 months, we give them a test. So that was a little odd for me. Yeah, and then get this, I even had a registration clerk get pissed off at me because I was asking a simple chief complaint on somebody. So I can quickly put a little mini assessment in there with just a chief complaint and an ESI, even though I don't know anything else. She got pissed at me for asking him that in her little cubicle. And I was like, okay. And then she came back to tell me why she was pissed at me for that. And she thought I had asked him about his HIV status. I tried to explain to her that I was not asking that. I was actually asking his chief complaint. And she proceeded to talk over me and say, don't do that again because that is against HIPAA violation. Thank you. I realized that. There was nobody in the waiting room at that moment. So who's HIPAA violating? Oh, fuck. Yeah, so tonight will be another drink night. Yep, just to kind of just chill this out. So y'all have a good night. I don't even know what day it is. Well, I said it was day 21, but I don't know what it is for working. I just know I have 9 shifts left, so yay me. And then I'm getting the fuck out. Never coming back. Yeah, so there you go. Nothing really exciting to add except I hate their fucking triage. Bye.